Hello, everyone. Welcome to the Atos Medical Clinician Podcast. I am here with two wonderful clinicians from the VA Pittsburgh Healthcare system who are going to talk to us a little bit about the foundations of surgical airway management, a virtual case study series, webinar series that is going on as we speak. And I will let them introduce themselves. Could you please just tell us a little bit more about you?
Sure. Thanks, Samantha. I'm Chris Matthews. I'm a speech pathologist, and I am the Audiology and Speech Pathology Service Chief at VA Pittsburgh Healthcare System. And this is our third year with this webinar series that VA has partnered with Atos. And this is actually the first year that we've kind of focused on the foundations. So I'm going to let Rhonda introduce herself, and we'll talk more.
Hi, Samantha. My name is Rhonda WinansMitrik. I am also a speech pathologist here at the VA Pittsburgh Healthcare System, and I have the opportunity to lead our interdisciplinary surgical airways treatment team here at VA Pittsburgh, and I'm also chairing the conference this year. So thanks for having both Christine and I today.
Thank you so much. I am so excited to talk to you about this wonderful series. I've been listening to it for a couple of years now, and everything that you've put together since the pandemic. I think you all adjusted really well and provided speech language pathologists an awesome opportunity to learn more about surgical airways. And I'm going to let you, Christine, talk a little bit about the historical perspective and how you came up with this series and what it's all about.
Sure, thanks. So I think it probably all started back in 2014. The VA hosted a number of regional conferences across the VA healthcare system. And there were a group of us that went around and we talked about fundamentals of managing veterans with tracheostomies and laryngectomies. And we, as a product, one of the products from those regional series was a group of us authored VHA guidelines, clinical practice guidelines for managing veterans with tracheostomies on and off the ventilator. And what we found after doing that is that a lot of sites, even though these clinical practice guidelines existed, still had a lot of really hands-on questions related to the patient that they were seeing now. Mm-hmm. So a lot of us were getting emails that would come out on the listserv, and we were doing our best to answer them, but a lot of the same questions kept coming up over and over again. And so like a lot of things with more complex areas of practice, we decided pre-pandemic that we were going to hold a face-to-face conference in Pittsburgh. Mm-hmm. And we had a fabulous panel of speakers lined up, and it was going to be a 2-day immersive laryngectomy and tracheostomy conference. And then everything changed. So we knew we had to pivot, and we decided to present this information virtually. We were able to retain many of the original faculty that we had signed on for the in-person event. And so starting in 2021, right in the middle of the pandemic, we were able to offer a series of, I think it was 6 the first year, different virtual presentations, all with different topics that spanned both tracheostomy and laryngectomy topics. And then it was such a big hit that we decided to do it again in 2022. And so I was chair those first 2 years of the program. And then we realized that we needed to scale things back a little bit because we have all the time new people joining VA healthcare, not just in speech pathology, but also nursing, respiratory therapy, pulmonology, critical care, ENT. And we wanted to scale it back to some of the basics. We had a couple of advanced 2022's series focused on advanced clinical topics. And so we decided, based on feedback from the participants, what we really needed to do was get back to the foundations. And so Rhonda took over this year, and I would, love to hear from her perspective, how things have changed and why we decided to shift the focus and what it looks like this year for 2023.
Absolutely. Thanks, Chris. So we did strip it back to the basics, just as you say. And, that's really important because this patient population does have, a risk of high morbidity and high mortality. But we also realized that we as speech pathologists, we're just one member of these teams. And so I think we were really pleased when we added a respiratory therapist, Romney Barhume from the VA Ann Arbor, onto our conference planning committee this year. And additionally, all of the talks throughout the year are interdisciplinary in nature. So not only is there a speech pathologist and a respiratory therapist providing the content, but for most of the lectures, we also have registered nurses as well. So we're really trying to bring together multiple team members to talk about our patients with surgical airways and guidelines or clinical practice recommendations for management.
Exactly. That is wonderful. The historical perspective, actually, I had no idea that it started off as an in-person conference. So, and then again, how you just pivoted so well to provide this offering. And the other thing that I really love is that you really are a one big team within the VA, but then how you've also offered it to the community so anyone can come, and brought in different disciplines. So what a unique opportunity. And so the topics this year are more of a foundation. Rhonda, I think we had the first one, I know, and that was wonderful. I can tell you that we had over 600 people registered, over 280 attended the first one on August 10th, Interdisciplinary Clinical Practice Recommendations for the New Tracheostomy. Can you tell me a little bit about how you chose the speakers for that particular webinar?
Absolutely. And just so our listeners are aware, the way that the webinar is set up this year is the topic for the month of August is tracheostomies. So there are two presentations that are 2 weeks apart. As you said, Samantha, the last one was last Thursday, and that talked about clinical practice recommendations for the new tracheostomy. And then next week, we are having two speakers, a respiratory therapist and a speech pathologist, talk about pathways to communication and decannulation after tracheostomy. And we chose those speakers because they are really experts in their field, and they have boots on the ground, and they are caring for these patients day in and day out. They have a passion and love for education, not only, within our healthcare system, but they are invited presenters, across the board, and they're just really enthusiastic about providing the best care that they can to our nation's veterans. So we're really excited to have both Rebecca Ruffing, she's a speech pathologist, and Jake McKee back with us again next week to talk about pathways to decannulation.
That's wonderful. And then in September, we'll move on to a different set of topics. Can you tell us a little bit more about those?
You got it. Yeah. In September, we're going to be talking about patients living successfully after total laryngectomy. So we're going to start out mirroring just as we did for the tracheostomy lectures. And we're going to start out with interdisciplinary clinical practice recommendations for the total laryngectomy. And then 2 weeks later, we are going to talk about some guiding principles for successful living after total laryngectomy. And we have another strong team of a speech pathologist, we have a respiratory therapist, and we have a nurse to present those topics. So Laura Applebaum from speech pathology will be joining us. Samantha Clark, who is a respiratory therapist by trade, but she also just joined our education program here at VA Pittsburgh. So I know they're super excited to have her on board now. And then Caitlin Kohler, who is a nurse in our step-down unit.
That's wonderful. And I think this is a really unique opportunity for clinicians and in an interdisciplinary way. How can individuals sign up for this series? And is there a cost to it? I guess I should ask.
Yes, good question. No cost at all. We truly appreciate the partnership with Atos Medical for taking care of all of the logistics with regards to registration and technology. All you need to do is go to atosmedical.us, their website. You're going to click on professional education, and then you'll click on webinar events. And there's a registration form there where you can sign up and register for the entire conference. If you miss a live offering, don't worry, because all of the material is being recorded. And it's available the first day of the following month. So for instance, in the month of August, we're talking about patients with tracheostomies. So that recorded content will be available in September. The September content on total laryngectomies will be available in October. And then I don't want to leave without mentioning our October content, because if you've seen our webinar series in the past, you know that Dr. Christopher Brackney and David Eibling are keystone speakers.
Yes.
Their dynamic clinical conversations, we're still getting feedback about how engaging and amazing they are. So don't miss them on October 19th. But again, in case you do, that will be recorded as well. And the recording will be available on November 1st.
Yeah, that's good to know. So if individuals have missed the August 10th, and even after this podcast may come out after the second offering, they can still sign up and listen to all of the offerings and also get CEUs, correct?
You got it. Yes, CEUs are available through AARC for respiratory therapists and through ASHA for speech pathologists.
Well, thank you very much, Chris and Rhonda, for talking to me today about the series. And I think it's a very valuable asset to the speech language pathology community as well as to RTs. So we really appreciate you putting this together, and thank you again.
Thank you.
Thank you so much for having us. We hope to see your listeners in a couple weeks.